My name is Pritam Steiner, and this presentation was done in collaboration with Maroof, Olanigan, and Dionne Ferrette. We'd like to explain to you why our business plan of hiring nursing staff as telehealth resource managers and educational media developers for the pediatric oncology population with central venous catheters is both a time and cost-effective proposal that will enhance the well-being of this very vulnerable population. Did you know that CLABSIs are the most common type of bloodstream infection? In fact, 84% of all bloodstream infections are caused by central lines. They're the most common in pediatric oncology patients. A single infection can cost anywhere from $6,000 to $69,000 to treat. And even more damaging are the prolonged hospital stays. It's estimated that CLABSIs can prolong hospitalization by 21 plus days. But most importantly, CLABSIs are preventable. 65 to 70% can be avoided by drawing on evidence-based practice, clinical excellence, and patient education, especially for those who are discharged home with central lines. The reason for this project at this time is that we're dealing with a very vulnerable high-risk population. These children undergo many procedures during long hospitalizations, have invasive lines, and become neutropenic due to their oncological treatment regimens. They're discharged home with central lines, and their parents responsible for caring for them. Can you imagine finding out your child has cancer, and then having to learn comprehensive central line care prior to being discharged? The Pediatric Oncology Department experiences high CLABSI rates. Around 36 patients are afflicted each year. The healthcare costs associated with treating them are extensive. At an average price of $32,254 per infection, our facility spends over $1.1 million each year on treating this population's CLABSIs. Our 2-year project goal is to reduce the current annual pediatric CLABSI rate of 36 by at least 50%. Other goals include achieving national initiatives, such as patient safety and infection prevention, increasing patient satisfaction by providing around-the-clock telehealth services, providing efficient discharge teaching that is streamlined among the in- and outpatient settings, but is also evidence-based, comprehensive, and individualized to each family's needs, and lastly, to enhance staff morale. An expert CVC educational team will be responsible for extracting evidence for patient education, producing educational media such as videos, and for providing the live telehealth services to our patients. Our first and second year budget includes the CNL and RN salaries and the cost of DVDs. The total budget for each year is around $129,000. Now let's take a look at the numbers and see how much we could potentially save depending on how many infections we prevent. If we were to reduce CLABSI rates by our goal of 50%, we would be saving the hospital over $450,000 annually. A 75% reduction would be even better, saving the hospital almost $750,000 each year, a goal that we believe can be undoubtedly achieved after the program becomes more established. Even a mere 25% reduction would result in over $161,000 of savings each year. The ultimate goal, of course, is to prevent all CLABSIs, which would result in $1 million plus savings each year. However, if our 50 to 75% reduction is maintained, a range of $450,000 to $740,000 would be saved each year, and in 5 years, a range of $2.25 million to $3.7 million would be saved. As appealing as the financial cost savings may be, let us not forget the non-monetary gains. Some qualitative gains we'll experience include increased patient and family-centered care. Patients will be more educated, therefore more compliant and self-sufficient upon discharge. The resource support will provide patients and their families with confidence and autonomy as they journey through their own health care in the home care setting. And by including the patient and the family in the plan of care, we'll build and maintain relationships, therefore enhancing patient satisfaction. And lastly, we'll be creating an educational environment for nurses to thrive in providing quality patient education, for parents to feel empowered to provide quality care, but most importantly, an opportunity for the children to learn about their illness and how to care for themselves. Other benefits that we foresee include excelling in Joint Commission initiatives such as patient safety goals, infection prevention strategies, and the implementation of evidence-based practice, and reducing financial costs, as well as the devastating morbidity and mortality rates associated with CLABSIs. Thank you so much for listening to this brief summary of our project proposal. We hope that you gained some insight on the severity of the problem we're trying to overcome and are as excited and passionate about this amazing opportunity for both our patients and our institution.